Thank you all, everyone, for being here. I know we're getting close to the end. I have the important, unfortunate role, I don't know, of being the last person to go, the closer. Since we keep talking about the Yankees, the Mariano Rivera of this event, thank you all for being here. I know we're getting to the end, so I just want to reiterate our gratitude to all of you who were panelists and presenters, like my friends here, everybody who joined in to sharing all of this knowledge. Just please give your hand for everybody. So before I was speaking in front of 300 people, I was speaking to groups of 10 to 15 in inpatient psych hospital. So that's maybe where I felt more comfortable. So we're going to start how I would start my therapeutic groups. So I just invite everybody just to take a couple deep breaths. Just bring your attention to this room, to this space, to your body, to your breath. Feel the earth beneath you. Thank you. I'm so glad I don't have to chart this. That would be a lot of notes. For those of you who haven't met me, I'm Jared Wyma-Bradley. I'm on TAC's team, on our implementation team. I work on some of our training resources, and over the last year, I have been tasked with putting to use this amazing tool, this program evaluation tool. Our program review tool is not just looking at the data of your program, it's overseeing sort of the program in whole. So today we're going to discuss that tool, and we're going to talk a little bit about its development, where it came from, how it got created, and then we're going to ask my friends here what it was like to go through getting your program evaluated. They freely volunteered to be a part of this. How many of you have ever had a JCO survey, a Joint Commission survey? Can you imagine volunteering for that? But our review it's not intended to be like JCO. It's intended to be more like us coming with you to partner with you in program improvement, to help give you a guidebook on what to look for, and then to give you recommendations, and then to give you tips on kind of, improving those things that we highlighted. So before we get into the development of the tool, I just want my friends here to introduce themselves and the program that they come from, and what their role is in that program.
You want me to go first? Hi, Judge Rusu, probate judge of Mahoning County, Ohio. I'm the chief bottle washer there. These people do all the hard work. They just point me in the right direction.
I'm Michelle Worth. I am the clinical director for Mahoning County Mental Health and Recovery Board. I don't even know what my role is. I'm kind of like the AOT monitor. Like the three of us are like the AOT monitor. My role really is responsibility to make sure that the client is getting the services that they need and making sure that they're connected to the appropriate services.
Hi, I'm Marla Golick. I am basically, like Michelle said, one of the monitors, the AOT coordinator. I work closely with Michelle and both Judge Rusu and Shannon just to coordinate basically the program between Fresh Start Court and the AOT clients themselves.
My name's Shannon Hudspeth. I am Judge Rusu's assistant, but I also kind of serve as the court's liaison for Fresh Start Court. Judge Rusu relies on a lot of the information that I collect from the providers in conjunction with the Mental Health Board for when he has the AOT Fresh Start Court appearances.
Thank you, guys. So let's get a little bit of the lay of the land. Why develop this tool in the first place? Most AOT programs are less than 10 years old. They spring up from a small group of passionate people that want to help serve a need in their community. These programs tend to sort of pop up one by one throughout a state, and sometimes with little input from the state itself or from neighboring jurisdictions. You can kind of feel like you're on your own trying to get these things started and continue keeping them running. After a few years of implementation, how do you know if the program is working? How do you keep improving it? You could look at research, but there's not a ton of research. It's not that there's no research. We would love for there to be more. There is some good research out there, right? Things that show that the court order does matter, that length of time on the order does matter, but we want more research. To get more research, we need programs to be implemented in a similar fashion. We have to be able to compare program to program, practice to practice, in order to isolate variables, to show what's effective. So we need some sets of common practices. The AOT program review tool is meant to create a set of common practices and assess a program's adherence to those practices. Because the reality is we want more research. We want more programs. We want better programs. We want more and better outcomes for the individuals that we serve. And obviously, in general, continuity with evidence-based practices predicts better outcomes. That's kind of why we pursue evidence-based practices. But we need more evidence to establish more evidence-based practices and to get better outcomes for the people we serve. So where did this even start? Where did this begin? Well, this wasn't just something that we came up with on a whim. It wasn't something ChatGPT created. The development of this tool required input of dozens of experts in the field over many years. All those people that we were standing in front here just a minute ago, them among dozens of other folks contributed to the input of building this tool. Back in 2017, a clinicians group, back in 2017, the AOT core elements were written for the Ohio AOT manual. The clinicians group, shout out to, I have some names I'm supposed to shout out here, Holly Cundiff and Kana Lastovica. Are you in the room? Nice. They're in the room. They are shy. And Amy, of course, who neglected to include her name. Her and some others, and Carol Stanfield, came together. Yeah, applaud these people. They came together to say we need to create some sort of a tool. Now you'll see there's some foundational things here, the core elements, the white paper, which established the building blocks and the essential elements. They came together, they took some of these things and said, we need a tool. We need some way to evaluate programs. So they started that work, and then they brought it to AOT, this big group of people here. They divided the program tool into the different core elements of evaluation, all these different areas of evaluation. They split up, worked together on that, brought it together, and so finally in 2024, we have the first draft of this tool. That's when we started trying it out. So last year and into this year, we tested the tool. We took it to a couple programs, evaluated their programs, and they evaluated us in our implementation of the tool. That led to edits and how we did in the process, the addition of certain sections. We added a judicial participation section so we can evaluate how judges participate in the program and what their role and input is. We changed the scoring to be a little bit more clear, and we refined what to look for when assessing assessment and treatment practices. In short, the goal of having a tool is programs that are implemented using common practices, right? We want to start there, which enables more effective AOT implementation, which hopefully begets more AOT programs, which leads, most importantly, to what this is all about, to more programs to provide more treatment options for people living with severe mental illness. That this all comes back to us trying to serve this population and serve it better. So for you, if you wanted to do this, why would you volunteer to have your program evaluated? Well, one, it offers a guide to implementation. And one of my favorite parts of it is it really promotes collaboration. It gets everybody together, everyone in the same room. Let's talk about this program. Where is it at? Where has it been? Where do we want to go with it? Let's, pause, pull our heads, out of the fray of running this program every day and talk about how it could be better. It aims to improve quality of service, obviously, by identifying gaps in implementation and creating more sustainable programs. Programs become more sustainable by identifying these areas of inefficiency, ineffectiveness, proving that it works. So then, as part of this, we're also offering a structure for implementing these recommendations. It's not just a scorecard and then we run away. It's us guiding you. It's this team of experts guiding you in how to solve those problems, how to fill those gaps, and offering the resources of this whole room, right? Of all these experts, of all the experience of all the people trying to improve AOT. And, it can really be a motivator because we don't want to this isn't just to be some sort of, finger wagging. It's also a chance to highlight what's really working. Hey, you guys are doing this great. How often does your team all get together and talk about what's really working? How great you're doing, high five, good job. So it can also be a great chance to share the results with your team and say, look guys, we're doing good work. We're serving this population, our community, really well. So what do we evaluate? These are the different areas of evaluation. And I'll just talk real quick about what each one sort of means. Program philosophy, we review the entire team's understanding of and commitment to a shared philosophy of care. We want to make sure everyone's working in the same direction. Eligibility criteria, it's important that programs understand and publicize clear eligibility criteria to the community around them, to folks who may be referral sources, so that you are receiving appropriate and continuous referrals. Participant identification, we want to see where the program is sourcing referrals. We talked before about do you get folks from the correctional system? Do you get folks from the community? Step up, right? Step up into AOT. Where are you getting participants? Judicial involvement, we review the judicial officer's understanding of severe mental illness and its treatment, and we want to assess the atmosphere of the courtroom and those interactions. We also want to look, obviously, perhaps most importantly, at assessment and treatment. We want to see, is the care person-centered? Does the participant have choice? Do they have involvement in their treatment planning? Is there that active, continuous outreach with participants? Do they receive appropriate services like case management? Staff training. Are staff onboarded with some understanding of what AOT is? And do they receive, did they come to the 2025 AOT Symposium? Did they get some extra training? And evaluation. We've talked a lot about evaluation. Now there may be, it's a little confusing because we're talking about program evaluation as a whole, the whole program. But usually when we talk about evaluation, we're talking about data, outcomes. Are you tracking outcomes? Are you measuring the impact and effect of your program? And are you sharing that with each other? Are you talking about it where there's those gaps, where it's not working? And that can also be a great way of publicizing, hey, look, our program is working. Client choice, obviously incredibly important. Do clients have say in their treatment? Are they involved in the treatment planning? We want to look at treatment plans and see goal for participant isn't just take medications, right? We want to see this person's goal is to have a cat have a pet. This participant's goal is to get better at playing the violin, which we talked about with your guys' program. So we want to see the person's goals, their life, reflected in their treatment. And then the maybe boring sounding one, building blocks and essential elements, but really important. Does the program demonstrate these values and treatment approaches in their policies and procedures? Is it written into practice? This is a little bit more in depth of kind of what each of those elements look like. When we look at a program, this is what we're looking for. Program philosophy, these fundamental values and principles, the things that guide decision-making and treatment approaches. Again, when everybody is committed to the same thing, committed to evidence-based practices, procedural justice, person-centered treatment, proactive outreach, court-reinforced participation, we want all of these components working in harmony towards the same goal. Why even look at evaluation? Like we talked about, measuring program outcomes, it provides objective evidence of a program's effectiveness and highlights those areas needing improvement. Sharing this data with program partners fosters transparency, it strengthens collaborative relationships, and enables collaborators to align their efforts toward addressing identified challenges. Think about the presentation that Dr. Cindy Gibson gave us this morning. Wouldn't you love to have data like that for your program, showing what it's doing, how much money it's saving, how many lives it's saving, how many hospitalizations, days in all of those things? We would love to see that too in your program. And again, those building blocks and essential elements. By explicitly addressing critical elements like cost allocation, right? Some of the boring stuff, but important stuff. Communication procedures, non-adherence strategies, safeguarding participants' rights. The program creates accountability mechanisms and prevents implementation gaps that could undermine its own effectiveness. So we want to see consistency in policy and practice, which it can be hard. So what does this process look like? It's this big process of us taking a look at your program. So we'll do a site visit, and that's kind of the big thing you might think of. That's where we come and we would observe your program in action. We would sit in court, observe court check-ins or hearings, see that interaction with the judicial officer, case managers, the participant, who's all in the room, what is it like? We would observe a collaborator meeting. So all of your team together, everyone together, what is that like? What's the communication like? What do you guys talk about? We will do interviews with participants and ask them about their experience in your program, and with case managers, and ask them about what it's like to be a part of the AOT program. We'll also interview your team. So we'll talk to your whole team, and ideally we want to have representation from the court, from the treatment team, and from administrative personnel, so we can really try to capture a picture of the whole program. And importantly too, some of the boring stuff, we'll review policies and procedures. We'll review your written documentation. We want to look at your participant handbook. Does it have participant rights in there? Does it have a process for redress if there's a rights violation? Does the participant have your contact information? Do they know the names of their team members? We want to see what sort of materials you're giving them and what sort of materials you're giving to the community around you. And we too importantly want to look at charts. So your record, the chart record, clinical records. When there's this first sign of treatment non-adherence, participant is late to a meeting, participant doesn't show up to an appointment, we want to see in the notes, what was your response? What did you do? Did you reach out? How often did you reach out? What did you do to really engage, right, that active engagement? So as an example, this is what a score looks like. These are two separate questions, and these are about judicial involvement. And you'll see the score ranks from needs improvement in development to meets expectations. The first is regarding the judicial officer's understanding of the AOT program, their understanding of the role of each team member, and their communication with the participant. So you can see it ranges from unclear communication, misunderstanding of roles, to clear, accessible communication and a clear understanding of roles. The second one has to do with the courtroom. Is it tense? Is it chaotic? Is the judicial officer discouraging or intimidating? Are they celebrating even the smallest little victories, the smallest steps in the right direction? Does everybody get to chime in? Does everybody have participation? Does the participant get to share their perspective on what's going on? So you can see this is more of the scoring itself is more of a qualitative score. It's not 3 out of 5, 8 out of 10. It's needs improvement in development, meets expectations. That's what it would look like. So these are all those different categories. You can see this is an example of what a score would look like. We opted for this more qualitative score because we wanted something that wasn't so numerical, and we wanted it to be, the emphasis to be more on the learning, on what can we do about this. Let's say you did one of these every 2 years. You don't want, what I wouldn't want is for you to look back and say, we got a 7 out of 10 last time and we got an 8 out of 10 this time. Because what does that really tell you? We want to get more into the weeds of like, oh, we forgot to include this thing in the participant handbook. Or, we said we would meet quarterly and we've only met once a year as a collaborator team. Let's talk about like the specifics of what program improvement is and not just be distracted by a score. Note too that there's not an exceeds expectations score on there. That is something for the reviewer to put in the report. That doesn't mean we're not highlighting it. That is something that will be highlighted in your report. Say, hey, we want to pause and give you a shout out for what's really working well, but it's not necessarily a category in the score. So I've been talking to you as if I'm going to be reviewing your program, right? Like, here's what we're going to do when we come visit your program. Now I want you to put your hat on as if you're a reviewer. You're going to go review somebody else's program. Because this is a tool not just for us to use, for TAC to use. This is a tool we want you all to use. That's the goal eventually. So you're a reviewer, and I give you this spreadsheet and all these boxes and scores and say, go review a program. We want this to be easier than that. We want this to be as plug and play as possible. So we also created a handful of other resources to go alongside it. The program team, like interview questions. So we pre-wrote like interview questions for the team. We created a guide for how to do this whole process that includes a checklist for the people being reviewed, the program being reviewed, and for the reviewer. Did you communicate this? Did you send them this? Did you ask for this? Did you receive this? One component of the review is observing the program's collaborator meeting. So we created an agenda for that, a sample agenda, interview, like questions that you might ask, things that you might want to look for. Now, this is a lot to take in as a reviewer. So you're the reviewer. You've looked at all of this, you and your team of 3 people. How do you compile all of that data and compare it? We also have a review data collection spreadsheet where you and your team members would each put in what you found. The supporting documents, we're missing this. When I observed the court, I noticed this. And then you can look at all of your notes next to each other. So it's meant to be pretty simple once you get the hang of it. We also made a printable workbook so that you as the reviewer, when you're on site in person, you don't have to have your laptop open, clicking away. You can just sit there and take your notes really quickly. So testing the tool. So I want my colleagues here, my friends, to introduce their program a little bit. We were in we did 2 reviews, one in Mahoning and one in Richland County. Ohio has a lot of representation at this conference. So I'm going to turn to you guys for a second. Can you describe your program? How old is it? What's the town like? How many people have you served about?
They always throw me under the bus. Mahoning County is a county, one of 88 counties in Ohio. We have about 230,000 people in our county. I think I said yesterday in my other presentation, I was a practicing lawyer, and I didn't know anything about the mental health system. I did guardianships for mentally ill people, but I didn't get to know the diagnosis and things like that. I was handling the legal end of it. When I became the judge about 12, 13 years ago, it became apparent to me that there was a problem, because I kept seeing these same people over and over again on my mental health docket now that I had to get to know about. I was fortunate enough to be in a program that I think there were a lot of resources already established in Mahoning County that the Mental Health Recovery Board was already implementing and doing. They just didn't have the judicial buy-in at the time. I'm not giving myself any credit. I just fell into it. It was something that I liked to do. I wanted to learn more about it because it was something I didn't know about. And so when the team came in and did the collaboration, it really showed me that we were already collaborating in Mahoning County well before I got involved. So they already had a good established foothold. It was just when I came on board, they had the final piece of the puzzle, and then it just like clicked. And I don't think I'm speaking out of turn. I'm going to have my medical director tell you that.
Yeah, when you came along, you created more structure for the program. So we had an outpatient civil commitment, but we didn't really have any structure. And the individual who was in my position before me was not a fan of policies and procedures. We would always ask him to put something in writing, and he never would. So we were doing it, but we really didn't have any guidance. And then when Judge Rusu came along, he really did his research and looked at, okay, what do we need to do differently? And so we just began doing it. So when we were asked to have if we wanted to participate in the evaluation, I wanted to do it because I knew we needed policies and procedures, and I needed a kick in the butt to help me structure it. So the process is really, really easy. You guys made it super easy for us. The results were not a surprise, and I don't care what he says. I know it doesn't feel like, it's not punitive, but the overachiever in all of us, we want exceeds expectations, So you get over that emotional side of it when you first look at it, but when you're looking at what their recommendations are, I knew there was not one thing that you guys recommended that I was not expecting. And then giving us the structure of, okay, this is how you can do it. That's going to help me because I hate writing policies and procedures, and it's like the bane of my existence.
I do want to, before we get into that stuff, I do want to hear that sort of why even do this? What made you read an email, read an invite, and say, we should do this?
Yeah, and I can kind of speak to that because I've been with the board for 18 years, so I've kind of seen this come into fruition through not just an AOT program, but an AOT program to when Judge Rusu came on board, and then we added the judicial piece to the final, piece of that. But I remember the day that Judge Rusu sent the email with you asking for the evaluation, and it said, "Team, I'd really like to do this," and I just remember going, ugh. Because I wear a lot of hats at the board, and I work partly with the budget, and in my head I'm thinking, not another audit. I can't handle another audit. But as Jared walked us through the whole process, it really was just super seamless. And like Michelle said, we needed that. We knew what we were doing, sort of, but we needed that piece to kind of get us rolling, to put policies and procedures in writing, and to kind of get us motivated to do more. Just the simple fact of, and I don't know if she's still here, but Amy showed us how to just change wording from taking the word compliant out of everything and putting adherence in instead, because it's just more motivational to the client. Just simple stuff like that. And what I liked most about it is when the evaluation was over, it's really not over, because they're willing to guide us along what we need to fix and take us to that next level. So, I mean, yes, the outcomes that we got, we're all overachievers, and we're like, we're not really happy with that, but we knew where we needed help with. So we weren't really surprised with what the outcomes were.
Let me add one thing to that. The only one thing I wanted to add is, I said yesterday, don't wait till you have funding. Don't wait till you know what the hell you're doing. Just do it. Jump both feet in. That's what we did. And that's why we knew we were not good in certain areas. And we wanted to see where that was and make sure we knew that's true. So don't wait to do it, guys. You don't need formal policies and procedures and things. We just did it. And we helped a lot of people along the way while we were kind of making our mistakes.
Yeah.
That's what I wanted to, that's along the lines of what I was going to say. When Judge Rusu implemented our Fresh Start Court program, we hit the ground running. We took off immediately. We had 5 people on our initial docket. And then through the years, it's just we've been doing more and more what I call good work, because we're helping these people and we're working through the issues and we're trying to get them what I say as a better life, like a higher quality of life. So doing the evaluation tool showed us where we were lacking and kind of makes us deal with it and makes us slow down and be able to address those things.
I bet some of you are thinking, if I got that email, I'd be like, whose idea was this? And so I'm sure you maybe had a moment, whose idea was this? And how did you get everybody on board? How did you communicate that with, the rest of everyone?
So I'm the boss. And if I tell them that they're going to do it, they're going to do it.
You pulled rank.
Yeah. No, you know what? We have such a good program, and we have such good buy-in from the community, from our providers. That's one of the highlights that came out. Like, you guys saw it. It validated that we do good work. I know we do good work. And at the end of this, it validated it for all of the providers. They had no problems. We just let them know, hey, these guys are coming in. We would like you to be a part of it. We want to have you interview. I don't think you guys had any problem with speaking with anybody or getting them to the table. So our providers are all committed to our clients and our community. So that was not. I don't think there was anything really hard about the process.
Yeah.
Really, it really wasn't.
Yeah. Pulling rank is a good way to get people involved sometimes.
And I
Yeah.
didn't.
And you didn't even have
I
to.
think this is a good idea.
Yeah.
Let's do it.
Yeah.
And yeah, they took over after that.
Going into it, where did you think your program needed to make some improvements? Going into it.
Well, we didn't have meaningful program evaluation. So we were collecting data. Well, Shannon was collecting data, but it wasn't really meaningful. So I knew that. I knew we were going to need to implement that. Educating the community really opened up our eyes a little bit, and it made us to start thinking about how can we do that and what that would look like. That was an area I think that we felt we could improve on. I want to include peer recovery. I want to expand our program, so that kind of also, it just jazzed you up to say, okay, what can we do creatively?
Mm-hmm.
Yeah, I mean, I'm a firm believer of written policies and procedures, and that's something that that's probably one of the biggest things that I want to tackle is just, we all tend to just say, okay, we're going to do this, and then just not write it down. And then a couple months later, we'll say, what, So that's something that, in fact, the three of us just agreed that we were going to start meeting, monthly and just start pounding out some, policies and procedures and get those in motion. And that was one of the areas, that you had talked to us about as well. So.
Yeah, and that's a good reminder that, your reviewers aren't just going to say, hey, you need a policy on this and walk away. We have example policies for most things in the resource library. So we can give you examples of that. I hate trying to write something from scratch. I'm like, give me 5 examples of what this is supposed to look like so I can know what I'm aiming towards. I mean, you saw today, all of this is the network that you were getting access to. These dozens, hundreds of programs and people and their policies. So you don't have to create everything from scratch. So your hand will be held too in writing those types of policies.
The resource library was huge for me. I went through and I read a bunch of that stuff. It was my light nighttime reading. But I went through that and I thought that was a big benefit of going through the program, and it kind of gives us the light at the end of the tunnel and a direction to work towards.
Yeah, very much so.
Now, when JACO comes to visit, it's normally like, 2 or 3 days. They're like snooping through every, sneaking up on you and like cornering you and trying to like catch you off. What was the process like of having the outsiders come into your program? How much time did it take? Just kind of describe what that was like for you all.
From the judicial side, it was nothing. I mean, it's such an easy lift. We had, I think, one Zoom meeting before you came to kind of say what was going to happen, and that was maybe an hour, more to like 45 minutes. Yeah. Then they sit in on our check-in hearings, which I didn't do anything different when you guys were there. You just would ask participants as they left, could we talk to you? But that didn't happen there. And then the summation after you guys left to give us our results. So I'm going to say maybe it was, from my standpoint, from the judicial standpoint, maybe 2 hours of my time. So it's not hard on the judges out there or the magistrates. It's not a heavy lift on our half. These guys a little bit more.
Yeah, I would say the only other thing that we kind of did that you weren't probably a part of is just sending you information, just sending you documents and attachments and stuff like that. And then putting together, making sure the charts, were in order and easy for you guys to read. But no, it was super laid back, was not huge time consuming at all. And then coordinating, letting people know what time to meet and come and inviting everybody along. But that was about it.
I was kind of nervous, like the day of court, to see how it was going to disrupt our flow, because when I established the docket for the day for the judge, I only give him, it's a tight ship. We only have small windows, and I was afraid it was going to disrupt the docket, but it did not. It didn't impede any of the processes. It was just very seamless and very laid back, I felt.
Yeah, well, you guys have a very big community of collaborators. So getting, when we visited them, there was 20, 30 people in the room of case managers, community services, everybody came together. And so coordinating that many schedules, that's probably one of the heavier tasks. But that's because you have a lot of people involved, which is good. Was there anything that surprised you about the feedback, about what was noticed?
I don't think so.
Yeah, ideally it's nothing shocking.
Did anything surprise you?
No, I don't think so.
Yeah, that's a good question. Yeah, we never asked that question. Yeah.
Oh, whoa. Turn those mics off. And what is your plan going forward? So now we have what we call it the final report, which I think we need a nicer sounding name for that. So I'm taking suggestions still. This is still in the beta process. So when you get that report that says, here's what we found, here's what's working, here's where there's some guidance, here's recommendations, here's what you can do about that. Now you have to kind of prioritize, figure out what you want to do next and how to implement that. What is your plan going forward? Now, we just did this like last month.
Yeah, so that's the plan is to get together.
Yeah,
so that's the plan is to get together.
This can be, an idea of a plan.
Right.
Concepts of a plan.
So we have to get together, decide how we want to prioritize, what's the most important, and then we're just going to break it down into steps. What do we need to focus on first? And then we're just going to divvy up the tasks and just kind of move towards it. So
one of the things that Judge and I talked internally as a court, there's going to be some things that like implementations that we need to do on our end that were brought to light in the report of things that needed to be added to the handbook and things like that we provided to the people. So that's something that we have to deal with internally as well outside of the mental health board.
I'm going to jump back to your last question. There was something that surprised us that we didn't think about because we've all been here since the beginning of this program. So we just know how it works. We know each other very well. We could share information. We know what happens. But you guys brought up a thing that said new staff, new employees, you have to have a training for them. Never did that cross our mind until you guys brought that up and we're like, oh yeah, geez. We just think we're going to be here forever and it's always going to just happen. So we want to lay a good foundation for the next judge, for the next board, medical director. So that was something that you guys really brought up that stuck in my mind.
Yeah, that goes into program sustainability, right? How do we make sure this keeps working after you retire, after somebody, moves on to a different role? And if, unless you've worked at like a Fortune 500 company, like most onboardings are pretty light, right? It's like, oh yeah, just ask Kate if you need anything. She knows where everything is. That can be your training sometimes. So that's not uncommon, right? We've all had jobs like that. And so it's just kind of elevating our standards of like, what would we want to tell somebody who's just joining today and help this program keep being as good as it is. Anything else you guys want to add?
I would just say do it. It's so easy. It gives you some concrete data. It's not punitive, but it also doesn't hurt your ego when you look at some of the places you need to get better. It's not lower scores because I think as a society, we're all used to the A's, the B's, and the C's. You're looking for that. This tool doesn't do that. It's really like you guys are exceeding here, you're meeting expectations, but here you're below expectations. So it doesn't make you feel as bad. So you high achievers out there, like all of us, it doesn't make you feel that way. And I like the way you did that. It doesn't give you the 8 out of 10. So I like that.
And one of the things that was said here today that was super helpful that I kind of regret us not doing is if you're new, just starting out on the program, is start your data collection early. Unless you can afford to hire Dr. Gibson, which I don't know if she could come to Mahoning County, but I mean that's one of the things that I wished we would have done like right from the get-go, because now we've got to go back and and just start doing our data collection, which is huge. So that's one of the tasks that I'm not looking forward to, but I know it's just going to help us. It's super necessary. So if you're new to the program, and one of the people up here on the panel said, as small as the data collection is going to be, if you're new, just do it. But yeah, that's really important. So
thank you, guys. Now they keep saying like the way you did it, as if this was my thing. I just want to reiterate, this was all of these dozens of experts creation. A lot of smart and talented and experienced people came together to make this. Now, before we wrap up, I want to offer you our plan for global domination. So what we would like to see is this tool utilized as a tool for state AOT coordinators. So think about, you are your state AOT coordinator. You have all these programs in your state. Wouldn't it be great to know how they're doing and have an evaluation tool for them? Now, if you have dozens of programs in your state, you by yourself and your little team can't go and evaluate all of them. But what you could do is create peer reviewers. You could review each other's programs. So we would love, our goal someday is for us to be able to go to a state coordinator, train them on how to use this tool. Give them the guide, give them all these, notebooks for taking notes. Here's how you evaluate this. We want it to be plug and play, right? We want it to be easy. They then can go and create these teams of reviewers, and you guys could go now and probably lead a review. You've been through it. You've seen, you know how it is. So you could go to your neighboring county and help in their evaluation, right? So this multiplies the impact, right? This it spreads these common standards, common practices. It makes evaluating programs, improving programs easier all around the country. That's the goal. Do you want to add something?
No. No, I was just wondering if you wanted to take questions.
Sure. You want to take answers? All right. Amy's going to take your questions. This is our global domination plan, and we have a third review coming up. I'm not going to say who. I don't want to jinx it. We have another review coming up, but we are open to other reviews. So if you would like to have your program reviewed, you can email us. I see a question in the audience.
So I just want to say quickly that while we had the tool before we had Jared, if it weren't for Jared and his phenomenal writing and organization, it would still be sitting there.
Hi, Stacy from New Mexico. My question is, when you've done that review, can you kind of put an official gold stamp on like, hey, we've been reviewed by the national experts, TAC? Only because as we go and like push for more money and push for legislative buy-in, I think having sort of that formality around it, kind of that stamp of approval from you all like at the sort of national level can really give some credibility to our programs and help us really sell this to expand even further. So just some food for thought, or I guess a question if you guys have considered that, or if that's something that would be, worthwhile to you all.
And I'm going to answer that.
I know Amy has thoughts.
We have talked about that, and the committee has wrestled with that question for a long time. And we know there's pressure to do that. But what we really want this to be is not a way to say, oh, we're great. We really, no matter how good you are, we want you to use this process to make yourself better. Mm-hmm. So we are not trying to say, here's your gold star, you're good. Mm-hmm. So that's why we don't.
I can add to that because there isn't a score for the whole program. There are scores for each category, right? So you guys didn't walk away and say your program got A, meets expectations, right? So that's part of that ethos of we want this to be honed in, narrowing in on those specific aspects of your program. Yeah, go ahead.
Well, the $50,000 question is, how might we obtain a copy of the tool to see your rubric, for example?
So it is currently being tested, right? So right now we're testing it. So we are going to do at least another evaluation, and then we will talk about releasing it entirely to, it's not like top secret or anything though.
It kind of is. Not because, it's not top secret.
Yeah.
But here's what we want to make sure is that we can maintain the integrity of the tool. So we don't want to just put it up on the web and have Tom, Dick, and Harry say, we can do this. Let's score our program. Look at us. We're great. When they don't have the training to use it. So we want to make sure it's used responsibly.
That's where that global domination chart comes in. is
Exactly.
We want to train. We want to be training the trainer for implementing the tool, ideally, because there's only a few of us, and we can't really do that many evaluations. All right, we got one here and one over there.
Okay, I'm hoping you can answer this. I was listening to how the evaluation was done in Mahoning County, and I'm wondering, in our county, I'm on the county board, and I'm the coordinator. We also have the probate court. We have 3 locations that provide case management services. Can you give just a brief kind of overview how that evaluation would be done? Because, like, I don't have charts. Probate court doesn't have charts, so how would that be handled?
Yeah, do you want to explain kind of how we did it with, because you guys have a lot of different case managers and providers.
We have different providers in our area that are all in different locations. And so you all get together at the end of the survey, if you want to call it the tool, but it's not hard. I don't think it's hard. I think the hardest part is just coordinating, telling everybody, hey, this is the day they're going to be here. They're going to be here you were here for 2 days with us. Mm-hmm. And here's what we're going to need. And that's where Michelle was useful, as well as Marla, getting them documentation for the charts and things like that, because we don't keep charts.
We do, though. Yeah. So the mental health board keeps charts. So we do, as part of it, we have, the providers has to provide us with monthly reports. But I do have to say that we ran into a little bit of a challenge there, because TAC did request to go to a site to be able to review charts, and the providers did not feel comfortable with that. So we had our one provider decided not to allow them to do that. So they just reviewed the charts that we had at the court, and I think that's something that you have to take a look at. Mm-hmm. But it also made us think that we needed to add more stuff from the chart, like a diagnostic assessment, obtaining the treatment plan to make sure that that's in the chart, because they do provide us with monthly reports. So as part of it, that it comes to us, and you guys get it too. So, yeah.
And maybe that's something you want to do, is have your judge talk to your mental health board and start having the providers provide a monthly. Oh, okay. Oh, okay. Okay. Yeah, that's what we had. Yeah.
I don't know if it sufficed for them. I mean, they did ask for we didn't collect. We were supposed to be getting the treatment plans, but we had been remiss in doing it. We meet so much, and we talk about the client so much that, like, we know what everybody's treatment goals are. We just hadn't formally done, held people accountable for sending that information in. So that will be something that we're going to add to it. To talk to them about whether it sufficed or not, I don't know. I mean, that's what we had, that's what we gave them.
But the thing of it is, too, is you'll know ahead of time what you're asked to provide. Like, once you start talking to the team, they give you a list of what is asked of you. So there's no surprises. It's not like they come in and go, oh, you didn't give us this, so you get, you know what I mean? Everything is completely transparent, so you know what's asked of you.
And real quick, this is why we're testing this process. So when we started, we have ran into issues of getting access to those clinical records, progress notes down to the details. And so what we will do differently is invite providers to that initial meeting. And before you sign on even to doing evaluation, we would say, have you talked to everybody? Are they involved too? Do they want to do this as well? Because HIPAA does cover evaluations. So we are able to look at charts under HIPAA. And what's important, why this is so important, is because this is all about treatment, right? All of these programs is about getting people treatment. AOT is a gateway to treatment. It is getting people this treatment. And so we need to see the treatment and how is it provided and what kind of outreach is done. And so we are learning ourselves as evaluators, as reviewers, how do we assure and reiterate the importance of seeing those records and keep making sure that everybody is on board with the evaluation process. All right, one more.
Yeah, hi, my name is Zach. I'm from Portland, Oregon. And I just had a quick question about sort of the length of these programs. I know with the SAMHSA grant, we had to be a new program to get that grant. So how long should a program really be established? How many people should it have served before you want to come out and do this evaluation on a program?
Do you have thoughts, Amy?
I always have thoughts. I think it's important to do it in your first year.
Okay. Thank you.
You don't want to get so far behind that you have a lot of catch up to do.
True. Start off on the right foot. Well, everybody, please thank my friends for being a part of this. Thank you, guys. Thank you, everyone.